Hi, everyone. My name is Jamie Gallagher, and I am a simulation educator and emergency nurse by background. I'm currently working at Thompson Rivers University in Kamloops, BC. And I have worked previously with new grads in previous regional educator positions throughout coastal health and interior health. And today I'm going to give you a presentation on hot debriefing. So this is a topic that's been of great passion of mine since about 2017, since I started recognizing and hearing about the literature regarding clinical event debriefing. And I have been on a mission ever since to try to expose people to the benefits and just the beautiful outcomes that clinical event debriefing with our healthcare teams can have. So this one is specifically directed towards the new grad population. I'm just So normally when I would kind of start out this presentation, or I actually tend to do usually a 4-hour workshop where we kind of do this didactic portion for the first like 45 minutes and have some robust conversation about our previous experiences with this. And then we actually spend a few hours practicing and utilizing a tool. But for the purpose of today, we just kind of wanted to give a general overview for anybody entering a new grad space. If you're asked to attend a hot debrief, what does that mean for you? And what might that look like and why are we doing that? So we're just going to discuss what is a hot debriefing, why we conduct them, and then some tips for success. So this session is to really delineate, for those who are new into the healthcare system, the difference between critical incident stress debriefing and hot debriefing, so clinical event debriefing. We really want to talk about the goals and the benefits to really create high-performing healthcare teams if we tend to work together on a specific line and we know each other and our colleagues well, and then something happens, really checking in with them and kind of exploring, how are you doing and what were some process or systematic issues that we know arise in the healthcare setting that may have contributed to any sort of like positive outcome or negative outcome for our patients and families. So just to make sure that we're aware of the difference, clinical incident stress debriefing is something that you may be asked to attend regarding a really traumatic or emotional event that occurred in your department. So in my background with emergency nursing, this usually would be a pediatric death or an unsuspected death that maybe really affected the staff. And we would try to include everyone from, BC Ambulance to, the care aides, the physicians, the nurses on board, lab techs, any other ward staff that came down to help, OR, anything like that. These aren't very common, but they are incredibly beneficial from my experience. But this is usually related and initiated from the managers. It is through workplace health and safety, and the people that facilitate these conversations are really trained psychologists and psychiatrists that work in an area of PTSD and emotional diffusing, which is not something that I'm recommending us as frontline healthcare professionals have, is those skills, because it is very detailed in how they process and engage in conversations around these events. So what is hot debriefing? So hot debriefing can be facilitated really by anybody. We usually recommend it's a charge nurse or an educator or somebody with a bit more advancement in leadership. And we do actually recommend nursing over physicians just because of the power dynamic there sometimes in the hierarchy. But that being said, I've had a lot of physicians in my time who have facilitated these discussions and they have been absolutely fabulous. So it really depends on the person. But you really want to discuss everyday events. Normally, we would conduct these after a code blue or a code white, or just maybe a patient fall or a really rough shift, whatever that may be, and it's done immediately after the event and to involve everyone. And again, it's voluntary. The goals of these are different. So this one is to improve teamwork and learning from the events. The other thing that's around the difference between critical incident stress debriefing is that's usually days to weeks after the initial event. It's not the same day. So hot debriefing is meant to be conducted on the exact same day that the event occurred. Because as soon as you lose all your staff and personnel, people's perceptions of the memory of the event and how things occurred is definitely going to skew. And sometimes you can never get everybody back together again because that's the only time where you're all together. Whereas the critical incident stress debriefing is meant to happen a few days, if not a week or so after the event. And people usually come in off of a shift and come in from home for these types of debriefings. So hot debriefing, by definition, it is a bit of a slang term, so I'm going to kind of use that and clinical event debriefing interchangeably. But it is really meant to just be a reflective learning conversation between colleagues. A lot of times after I've left codes when I was a new grad on cardiac back at VGH years ago, I used to kind of like wish I had all these questions that I didn't know why they did something or some of the meds they were using and all this sort of stuff. And rather than just kind of going home and like Googling it at the time or talking to my partner who wasn't in healthcare, this is an opportunity for us to kind of get together and kind of like have those questions answered and kind of talk about the who's, what's, or whys. And if we all don't know something, then that's something to maybe escalate to our educator at the time. But it's really meant to just be a conversation. And it takes place immediately after the event. So if this does happen, like a code blue on the unit or a code white, we really want to try and talk about it as soon as possible before, again, we've lost all of our personnel, because one of the barriers of this is really time. And we really want to focus it on like systems, process issues, or team dynamics and communication. Maybe where the code cart wasn't where it normally is because the unit's having renovations and that impacted a delay in care, or people not understanding a certain process around elevator use or code white protocols, or maybe the call bells. I've heard of this happening a few times where they've called for a code and it didn't actually work, or the buttons weren't working, or the overhead paging system, stuff like that. That really needs to be escalated um, incredibly fast, because that could impact somebody else on that same shift or the next shift if it's not dealt with in an urgent manner. So really kind of talking about any of the barriers to the care of the patient is really important. And then we want to do it as kind of close or near to the care setting as we can, while trying to also kind of keep these conversations private. So that's a bit of a tough one, but you're not meant to actually leave the floor and have these like, hour-long discussions, but this is kind of meant to be, in the nursing station or in an empty room, and kind of huddle people together and have a quick conversation for about 10 minutes about any sort of like opportunities to improve, and anything that we did really well. So that's kind of the gist of it. So our goal is to have a short discussion, not to focus on in a single individual who maybe performed poorly, such as like a junior resident was on the floor and was very nervous and didn't call out orders appropriately. This is not our opportunity to sit there and point fingers and attack. It's really there around constructive, feedback for the entire team, because everything in healthcare happens as a team. And it really is to focus on non-controversial content. And so if there is any sort of major emotional issues within that team dynamic, say maybe there was voices raised or interpersonal conflict, those conversations should be had, not in a group setting and maybe off the floor, and individual feedback should be had one-on-one. So this is for non-controversial content, and the goal is to kind of learn from everyday events and immediately discuss our performance. And again, sometimes we just really want to celebrate the positive. And even though there was maybe a poor outcome and we lost a patient who's maybe been on the unit for 3 months, and people are kind of feeling a bit like, oh, we were so close with that family, just doing a bit of a check-in. How's everybody doing? We did the best we could. We did everything possible, and kudos for a great job. And maybe this is for an educator or manager to just kind of say, my door is always open. Please come find me if you want to chat. So there's a lot of documented benefits of hot debriefing, and the literature is actually still coming out in great favor of this. Back in the 90s, there was a paper that didn't recommend debriefing, that it would maybe cause more emotional distress, but that's been, thoroughly debunked right now. So what the literature states is that it really is associated. So for teams that do hot debriefing very regularly, and I would say the emergency departments that I've worked in really have taken this on, it is associated with improved patient care, teamwork, and staff morale. You feel more cohesive, you feel a bit more like a team, you can lean each other and, admit mistakes or give feedback respectfully, and you just kind of grow together as a better team. And it really helps to promote self-reflection, like, oh, maybe I'm not up to date with my priorities or my My current policy around, code white escalations, maybe I should do some added education or reattend that workshop that was offered a few weeks ago or something like that, just to help promote that self-reflection piece, which I think we need sometimes. And then it enables the team to speak freely and ask questions and close knowledge gaps, which for new grads especially, this is such a huge component, is that a lot of times there's questions that maybe we're afraid to ask, but this is kind of the opportunity that this is the whole reason why we're having this debrief is to kind of ask those questions. There are no stupid questions. Um, what you learned in nursing school may be vastly different than what you're actually seeing in real life, and you want to know why. So asking that why is super important. So this is kind of the great opportunity for you as a new grad to attend this. And then it allows for immediate feedback. So say there is a major process issue, we need to escalate that and give feedback to our leadership team around like this needs to be fixed immediately because this could harm another patient down the road. And so to get on those kind of preventative measures early is for the best. Now, there is some research to show that regular debriefings with educators is helpful with the feelings of transition shock and feelings of stress and anxiety do go down. So there is some documented literature specifically around new grads and debriefing. And debriefing after clinical events has been shown to help talk through stressful events by allowing new grads to ask questions and decrease personal stress responses. And therefore, it increases their perception of job satisfaction. So, this is a great finding. So, really recommending regular debriefs, whether it be with your unit manager or if you have a regional new grad educator, whoever that person may be, but really ensuring that we have these opportunities to kind of debrief how things are going, especially within that first 1 to 2 years when you're out in practice, because the transition shock can be so incredibly overwhelming. And sometimes you just need to unpack how you're feeling, feel validated, feel like that's normal, and be able to ask those questions that maybe you don't feel comfortable asking on your unit. So it's a great opportunity and something that should be really encouraged and explored throughout the health authorities. When we look at barriers to hot debriefing, the lack of time or space is definitely one. The lack of somebody feeling comfortable facilitating these conversations. Usually it takes kind of somebody stepping up to the plate and saying, hey guys, can we have a quick debrief? And just having people that feel comfortable doing that. And then there's always that bit of a fear that it may become hostile or a blaming session, especially if things really didn't go well. Um, and so I haven't actually had this occur so far in my personal history with debriefing, but I've heard of stories where this has happened. So there is always a little bit of risk with these, and hopefully the people that are facilitating these can pick up and be aware if this starts to happen, that we end the debrief to make it psychologically safe for everyone. And sometimes we just need a chance to get together as a team and celebrate our successes. We just need to say, hey guys, we did a great job and we had a great outcome and we worked together well. And we just need to spend the next few minutes celebrating how great that was. Can I hear from everybody about what you think went well with this certain situation? And we don't do that enough. And, reflecting on those positive occurrences is so beneficial for everybody's mental health and well-being. So I think this is a huge benefit of having these debriefs. Now, the one thing that hot debriefings do require is, I'm sure you've heard lots about psychological safety, but it really is about maintaining a psychologically safe environment. And everybody in that team has to buy into this. So we all have to engage in the fact that we need to create a psychologically safe space for everybody. It's not one person's job to create psychological safety, it's everybody. So everybody needs to come to the table with that in mind, that we need to be okay to take risks and that we're not going to cause undue humiliation or embarrassment for anybody on the team. And that nobody's going to be punished for speaking their mind, not knowing or asking questions. Like, we need to be okay to 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 not know. One of the greatest things I've learned as an educator is to say those words like, I don't know. When I first started out, I used to think I had to know everything. And I quickly learned that that's not the case. So it's really important that we learn over time that it's important that we kind of create the psychologically safe space for everybody. And psychological safety goes beyond just words. You really have to walk the walk. So being mindful of our body language, crossed arms, eye contact, your tone of voice goes so far. for everybody to just demonstrate a bit of vulnerability, be okay to again not know and say, you know what, I screwed up or I didn't know this, is really huge to model that for everybody in the team, to really be authentic, and especially for the new grads to show emotion is totally okay. Healthcare and being a nurse is really hard. And if we feel emotionally impacted, it is okay to show that. And I really just think that that shows a very humanistic side of us. Um, and it's important if things really rattle you, because I think that just shows that, yeah, you care. And there's nothing wrong with that. And I think we need to really demonstrate that more and not bottle it up. So, things that can negatively affect high performing teams is a lack of psychological safety within teams. And I know that some units, some departments, some cultures within hospitals themselves have high levels of psychological safety, and some have very low psychological safety. And that is definitely going to affect how the team performs. So ineffective communication strategies, lack of adherence to protocols or policies, overconfidence in staff, equipment issues. If you're not used to using something and then you're asked to use it and you haven't used it or seen it in your training, that's definitely going to affect things and slow down the care for the patient. Major knowledge gaps, tech issues, short staffing, lack of experienced staff, or if we don't have mentors or strong mentors or leadership on the units, that's going to really affect the teams, because sometimes it's the blind leading the blind, and you've got a whole night shift of all new grads under 6 months to a year, and that can be really tough sometimes because you know there's nobody there to kind of bounce ideas off of. And yeah, it's just it's a really tough place in healthcare right now with how that's going. So we really want to try and retain experienced staff so that we can lean on them and ask questions. And that ultimately creates better patient safety, which is always our goal. So just to quickly talk about the model that we use, this is the Stop for 5 minutes Stop 5 debriefing tool. So it was, I think, originally published from Edinburgh. And so this is kind of the tool, but we modified it through the BC Simulation Network and the BC Emergency Network a few years ago with a little bit more of a preamble. So this is what you can find online and around a lot of the code carts throughout Interior Health Authority if you're working in here. Or I'm not sure what you might have in other provinces and across the country, but a lot of people do use the Stop 5 debriefing tool. So this is really just to ensure that we lay the ground rules, that this talk is just meant to be a short discussion and that is not for personal performance. And so we lay those ground rules that it's not for personal attacking or, directed feedback at each other, that we really want to talk about as a team. What did we do well and where are some opportunities that we can improve on? So we might give a quick summary of the case. This is optional, but kind of really unpack what things went well, and really celebrate that. And, we want to reinforce positive behavior, and then any opportunities to improve and really identify any of those, like what we kind of call latent safety threats or any kind of breakdown in communication. Um, and then any points of action that we want to escalate to our leadership team. So this is just kind of the structure. And we do try and make sure that it is, most of anything kind of discussed is, going to be, the findings are going to be shared with the leadership team. But again, if you're feeling vulnerable and you're feeling like you don't want to participate in this, it is always optional and voluntary. So tips for success, we really always want to be curious. Just change your WTF in your head when you see something happening and say, what's their frame? I wonder why they did that. So just kind of change that narrative in your head. Just be really curious why people are doing things different, or maybe different than what you learned or have seen in the past. It doesn't mean it's wrong. It just could be different, and that's okay. So validate each other and normalize when things are hard. I'm feeling that way too. I'm sorry you're feeling that way. I also felt like, we were so short-staffed that we couldn't attend to this patient and they fell out of bed. And, I'm feeling just so distraught over it. Just talk about it and normalize that this is how we all feel in certain situations. And that goes a long way for us being able to feel like we fit in and we're meant for this job and we're in this together. Be empathetic and respectful. Respect people's boundaries. Maybe people don't want to talk about it. Sometimes people need some time to process how they're doing. And so they may not want to engage in any dialogue for a few days or a few weeks until they've kind of like individually processed their emotions, and then they're going to be okay with opening up and talking about it. Really keep these discussions short, anything over 10 to 15 minutes, and people are really struggling to get back into their workday and get back to their patients and their priorities. So keeping it short is important. So you might have to cut people off. You may not get to everything, but you can always have conversations afterwards. At least this is kind of opening up that opportunity to have these discussions, and further conversations can occur after and involve everyone. I've had lots of debriefings where I didn't even recognize that there was the lab tech in the room at the time, where the patient coded or whatnot, and they may be a bit impacted more so than I knew. So just really being mindful of who's all involved and try to not just keep it inclusive to just nursing staff. It might be a bigger issue that you might need to involve the RTs or the lab or housekeeping or food services if they were in the room and a patient went ballistic and threw a tray. Like, absolutely call for them to kind of join you in this debrief and talk about things and how they're doing and any strategies for improvement to make sure that everybody's safety is a top priority. So really make sure that we're thinking about keeping everybody involved. So just again, a reminder that these are voluntary and can be requested at any time. So if people around you are looking particularly vulnerable, um, some people might just need to follow up one-on-one with an educator, but they do not want to engage in a group conversation, and especially when they're kind of new and learning their bearings, and that's totally valid. We all have bad days, though. Nobody is perfect, and we all make mistakes. Um, the only thing in healthcare is that our mistakes can lead to patient harm. Whereas, if you work at a clothing store and you don't fold something properly, it's not going to have huge consequences. But do know that we all make mistakes, and I have made many, many mistakes in my nursing career. And thankfully, I had a team to lean on and say, "Oh my gosh, I did this. Now what do I do? Help me through it." When you're in that like moment of shock. Um, and then to document that effectively so that we're tracking what am I trying to say? We're tracking, common occurrences, or tracking if certain mistakes are being made with certain medications repeatedly so that we can look for themes. That's really important as well. And then if you're wanting to debrief, um, and your colleagues have lots of questions, then ask for one. Maybe your manager or your educator just wasn't aware that this needed to happen. So just say, could we just have a debrief? Can somebody facilitate this? And hopefully somebody can step up to the plate, even the physicians, the RTs, anybody can maybe do it. So if you're not feeling comfortable facilitating this, hopefully you can ask for one. And then if you have a regional knowledge coordinator and you want to debrief one-on-one, that's also an opportunity to do that as well. Or if you have a regional educator for new grad support, somebody like that, hopefully there's somebody you can reach out to in the professional practice office or your education department, or however that looks for you in your health authority. So what to do if your debrief does go a bit array? Ask the facilitator to cut it off, remove yourself entirely, just walk away. Ask to chat to people one-on-one, debrief maybe with your leadership team first, or just if you feel comfortable, ask the group, can we just take a pause on the debrief and pick it up tomorrow? And again, this is really for the lead facilitators, but kind of just remind people of the ground rules that this is not for personal attacks. This is for team and system-based improvements. Again, this is very rare, but it can happen, especially in very emotionally charged situations. And if that is the case, maybe a debrief shouldn't be had at all. So what to do if you're still feeling emotionally upset after an event? Say you did do a debrief, but you're still really feeling a lot of, you know, either feelings of like shame, embarrassment, hurt, fear, or just sadness over what occurred, even if you were even just remotely involved. But talk to your manager, your educator, or your knowledge coordinator, and then they can actually always arrange a critical incident stress debriefing. So maybe one of these hot debriefs is just one step in a multitude of debriefs that need to actually happen regarding this certain event. And knowing if you're feeling this way, you're probably not alone in that. So do kind of seek out some resources to have a bit more of a formal debriefing. Um, there are numbers for employee family assistance programs. So on the back of the hot debriefing guide, it is 2 pages. On the back half of the debriefing guide, at the very bottom, each health authority's EFAP numbers are listed. So you can reach out to any sort of the free counseling resources that are available through the health authorities. And then lean on your colleagues, family, and ongoing emotional support. So it's just really important that we talk about how we're doing, especially as we're entering the workforce as a new grad, because there's a whole lot of emotions that come with with that transition. I still remember so clearly having a pit in my stomach every time I went to work for months and months on end, and then I got through it, and now 17 years later I still love nursing more than anything in the world. So we get through it. We get there. Now, there is a YouTube video to watch. This is Dr. Kessler out of Columbia University. I'm not going to show it for the purpose of time, but it would be something that would be great for you to watch. So I would just, I will put the link in here. Sorry, it should be Dr. Kessler from Columbia University regarding clinical event debriefing. So there is a 9-minute video that's really well done. Again, it's based in the emergency department, but I think it really depicts what this hot debriefing actually looks like in real time. And then there's some really great references. I have a podcast on that, on this that you can find on Apple Podcast. It's Interior Health Authority Nursing Grand Rounds on clinical event debriefing. And then there's some really great papers, some that are specific to new grads, and then just a bit more of the background on the Stop 5 debriefing model. But there's tons and tons and tons and tons of papers coming out around the benefits of this. And there's global communities really trying to push this for all healthcare professionals to really encourage people to do this debriefing more often because of the profound benefits that can occur from it. So if this is something you're interested in, feel free to reach out. I'd be happy to chat more. And that's my information if you wanted to get a hold of me. So jgallagher@tru.ca, and that's my cell phone number. But thanks very much for having me.